Hello everyone, my name is Fabian Proft. I'm a rheumatologist working at the Charité University Hospital in Berlin, Germany. And it's a real pleasure to be here with you today and be able to share my highlights from the abstract session on spondyloarthritis, including psoriatic arthritis, from Monday, November 13th, here at the ACR 2023 Convergence. And I selected 3 abstracts that I found of very importance for us as clinicians taking care of patients with psoriatic arthritis. And I will tell you why I think they have a high relevance. And I want to start with an abstract that was presented by Leahy Adder. And this was about gender differences and treatment response. And this was a meta-analysis assessing the clinical response on different therapies according to the gender. And what was seen here is that female patients participating in clinical trials are less likely to achieve efficacy endpoints, and this was more pronounced for biological DMARDs compared to targeted synthetic DMARDs as JAK inhibitors and TYK2 inhibitors. And I think this is of high relevance because we all need to take this into account when making treatment decisions with our patients. And this could be even a very slight but important step forward towards precision medicine and to further assess these differences and maybe reasons for these differences in the nearer future could help us to better understand what the underlying mechanisms and to optimize patient care for patients with psoriatic arthritis. And here I also want to highlight an ongoing prospective study assessing this, the SAGE study, SAGE PSA. This is undertaken by GROPPA, the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis. And here patients will be prospectively enrolled that need to be treated with a targeted synthetic DMARD or biological DMARD with PSA. And they will be prospectively followed up, and then treatment response according to gender will be assessed. And so I think this is one of the very hot topics in general, but also on psoriatic disease. And the second abstracts that I wanted to highlight were the phase 2 data from izokibep. And izokibep is a interesting molecule, and this is something that we really need to have in mind in the nearer future and watch out for, because I think this could really be a game changer. This is an oral IL-17 inhibitor, and it seems to have very high penetrance of the soft tissue, and therefore could be a great option also for areas which are not so easy to reach with the usual targets that we currently have in our armamentarium, like for enthesitis. And here now Philip Mees was presenting the phase 2 data of izokibep, and it's very important because we have seen the week 16 data already at EULO with really astonishing results. And because of these great results at week 16, the phase 2 study was terminated earlier because the company decided to directly go to phase 2b/3 study. And so now here at the ACR, the week 46 data were presented only for those patients that have already reached week 46 at the time that the study was early terminated. And here it was a randomized double-blind placebo-controlled trial with izokibep in 2 dosages, with izokibep 80 milligram, izokibep 40 milligram, and placebo for the first 16 weeks. And at week 16, those patients were then switched to izokibep 80 milligram. And were continued to follow up. And here the results that we've seen are really outstanding. The treatment response on different domains, arthritis with an ACR 50 or ACR 70 response with really astonishing results after 46 weeks, but also on enthesitis and dactylitis were really, really good. And I think this will be one of the compounds that we really have to watch out in the nearer future. And I'm eagerly awaiting the results from the phase 3 study, and hopefully having this mode of action in the treatment armamentarium for treating our PSA patients in the nearer future. And then the last study that I wanted to highlight was also presented by Philip Mees, and this was the foremost study. And what was so special about this study that I think it makes sense to highlight it here, this was a Premilast treatment, so a PDE4 inhibitor, but what was special about this study that this was assessed in PSA patients with oligoarticular disease. And so this is very important because we need to remember that almost all clinical trials in PSA, which we know and where we are basing our treatment decisions on, are coming from patients with 3 or 4 swollen joints at least, and higher numbers. So polyarticular cases. And I really have to say that in my clinical routine, oligoarticular disease is more often prevalent, and therefore having study data on this specific patient population will be of very much importance. And so here in the foremost study, this were the 16-week data on the oligoarticular PSA population treated with apremilast compared to placebo were presented by Philip, and the results were good. Apremilast was significantly superior over placebo, also in the articular disease, and was showing twice the MDA joint response compared to placebo at week 16, and also a higher percentage of patients with a baseline joint count below 4 shifted to a joint count below higher than 4 with placebo when compared to apremilast. So I think what we can say here is that apremilast could be a nice treatment option also for patients with oligoarticular disease. And this highlights also the need that we further assess this specific patient population in the near future. It was a real pleasure highlighting my abstracts that I found of key interest from the yesterday's abstract session on spondyloarthritis and psoriatic arthritis. My name is Fabian Proft, and I'm out. Have a wonderful day. Bye-bye.